The anesthesia that is recommended for your procedure is general anesthesia. During general anesthesia, your anesthesiologist will use a combination of medications to help you fall asleep and stay asleep for the entire operation you are about to undergo. While you are asleep, the anesthesiologist will monitor your body using the anesthesia machine and will stay by your side to protect you throughout the procedure. Monitoring includes activities such as ensuring that you are breathing well, that your blood pressure is appropriate to protect your heart and brain, and that your body temperature remains its best to ensure normal body functions like fighting infections. In addition, the anesthesiologist may place a breathing tube in your airway while you are asleep. The anesthesiologist does this because the medications that help you sleep also make your desire to breathe slow down. For this reason, the anesthesiologist may assist your breathing during surgery using a ventilator. The anesthesiologist will also select the best pain medications to minimize your post-operative pain. The pain medications selected are chosen based on your medical history and the procedure you are about to undergo. General anesthesia is relatively safe, but not without some risk. Let's review a few of those risks that patients are frequently interested in learning about. The risk of death from general anesthesia is 1 in 250,000 patients, which is extremely rare. Many patients ask about awareness under anesthesia or remembering something that happened during the surgery. Luckily, patients can rest assured that awareness under anesthesia has a risk of 1 in 250,000 as well and is also extremely rare. The risk of serious injury like stroke, heart attack, vision loss, or kidney damage is about 1 in 10,000. Certain people with a history of disease, such as heart disease, may have an increased risk. And so we often recommend preoperative testing to look for issues and protect our patients prior to surgery. Your anesthesiologist reviews this testing and decides if surgery is appropriate for you at this time. Other issues that are less severe, but not uncommon, include postoperative nausea or vomiting related to medications, or a scratchy throat due to having a breathing tube in place during the surgery. This concludes our discussion of the risks and benefits of general anesthesia. Please feel free to ask your anesthesiologist any questions you may have, as they will be happy to answer them for you. During your procedure, your anesthesiologist recommends the placement of an arterial line to monitor your blood pressure. An arterial line is a small catheter tube that is placed inside a blood vessel, called an artery. The arterial line then sends a wave of pressure to an electrode that converts the pressure wave into a blood pressure reading that can be viewed on the anesthesia machine. The advantage of having an arterial line is that the medical care team can monitor your blood pressure at all times, not just when a blood pressure cuff has been used. The risks associated with placing an arterial line are rare but worth mentioning. The most severe form of injury is damage or blockage of the artery, which occurs in less than 1 in 100,000 patients. An infection at the site of the arterial line occurs in less than 1% of patients. Other complications that are more common but less severe include temporary occlusion of the blood vessel or bruising, which can occur in 15 to 20% of patients. These temporary occlusions or bruises usually heal on their own. This concludes our discussion of the risks and benefits of an arterial line. Please feel free to ask your anesthesiologist any questions you may have, as they will be happy to answer them for you. During your procedure, your anesthesiologist recommends the placement of a central line. A central line is a catheter tube that is placed inside one of the larger veins in the body near the neck, chest, or leg, and ending near the body's center core. The line is placed for a variety of reasons, a few of which are: 1. A medication you are about to receive should not be given through intravenous, IV, lines in the peripheral parts of the body, such as the hand or arm. 2. Large amounts of intravenous fluids or blood products may need to be given during the surgery, and a larger line allows the physician to administer them at a faster rate than a peripheral intravenous, IV, line would allow. The pressures of fluids filling the heart can be monitored, allowing the anesthesiologist to make decisions regarding your care. Every procedure we decide to perform is for the benefit of you, the patient, but central line placement also has risks to consider. During placement, there is a 4 to 9% risk of puncturing an artery, a high-pressure blood vessel, while attempting to acquire access to a vein, a low-pressure blood vessel. Less than 1% of these punctures would injure the artery and require further medical attention, but bruising may occur. A central line placement has less than a 1% risk of allowing air to enter the chest, which is called pneumothorax or pneumomediastinum. If this occurs, a surgeon may need to place a tube in the chest to remove the air. Central line placement also creates a risk of infection or blood clotting inside of the vein that is related to the length of time it is in place. To minimize this risk, the line is put in place in a sterile fashion and the line is removed at the earliest possible convenience. An anesthesiologist is a specialty doctor with years of experience in protecting patients during the placement of central lines. In addition, new advances such as the ultrasound machine allow anesthesiologists to increase the safety of the procedure. This concludes our discussion of the risks and benefits of a central line. Please feel free to ask your anesthesiologist any questions you may have, as they will be happy to answer them for you.